Thanks for coming on. It's Kat with the Down Syndrome Association of Houston. Today we have Dr. Kim here, who is going to do a presentation for us on kind of things that can, not things that can happen, but ways to handle COVID right now. And I'm going to turn it over to her. If you have any questions, just submit them on the group chat and I will make sure that they get answered at the end of the presentation. Thanks.
All right, thanks, Kat. Thank y'all so much for spending the evening with me. I wish I could see some of y'all's faces, and I love meeting people in person, but I'm glad to be able to be here virtually with you all tonight. Usually when I give these talks, I like to mill around and get to meet people. So unfortunately, I won't be able to do that, but just as a quick introduction to myself, I'm a native Austinite, but I've been in Texas, or been in Houston for about 12 years now. I did all my medical training here, and I am now a primary care provider at the Baylor Transition Medicine Clinic, which I'll talk a little bit more about. I also see patients at Texas Children's, and I am a member of the Down Syndrome Medical Interest Group. And so I'm excited to be able to meet you guys and get to know your organization better. For those of you guys who maybe haven't heard about our clinic, I work at one of the Baylor clinics at the McNair Clinic across the street from the VA hospital. And we are a patient-centered medical home for adults with intellectual and developmental disabilities. And here's a picture of my team. It's a great team of physicians, social workers, medical assistants, service coordinators. And while we're not Down syndrome specialists per se, we do see a lot of patients with Down syndrome. And so I'm happy to be here tonight and just share a little bit about what I've seen in terms of the care of people with Down syndrome, and especially in light of our pandemic. So originally, I wanted to just talk about wellness and then particularly nutrition and fitness. But, you know, the elephant in the room is the pandemic. I don't think we can go a day or a conversation without mentioning something about COVID. And really, you know, this pandemic really sets the backdrop of what it means to be healthy in this day and age. And so I'm going to start off this presentation with first just kind of talking about COVID in general. I'll give some very high level information, probably a lot of things that you guys already know about COVID. And then I'm also going to talk a little bit about coronavirus and how and what we know about how it affects people with Down syndrome. And then for the last part of the talk, we'll talk, I'm going to talk a little bit about what it means to be healthy and what that may look like in light of the current situation that we're in. And specifically, I'm going to talk about the aspects of physical health, mental health, and social health, and some unique considerations for people who have Down syndrome. And like Kat said, I'm happy to take questions at the end. I'll save a few minutes at the end for that. So please do feel free, as questions come up, feel free to type those in the chat. And then Kat will go through those at the end. And I'll do my best to answer as many of those as I can. All right, so let's get started. So again, this is kind of just some basic information about COVID-19. So here is this little beautiful looking virus that has just wreaked so much havoc around the world. The coronavirus is named for these corona, which means crown in Spanish, like spike proteins that surround the virus. And so the coronavirus is actually, it's a single-stranded RNA virus, and it's not a new virus. So coronaviruses is a class of viruses that have been around for a long time, and it's one of the several viruses that can cause the common cold. So if any of you have had children that have gone to the emergency room or urgent care for cold-like symptoms, they may have gotten a winter respiratory viral swab done, and that's a panel of tests that can test for different types of viruses like rhinovirus, adenovirus. Coronavirus, again, is one of the viruses that are often tested for as the cause of a cold. Now, recently, in the recent years, there's been a few strains of the coronavirus that have been particularly notable because they've been particularly infectious, and then also some of them have been particularly deadly. And so in the last 20 years, you may have heard about outbreaks such as the Middle Eastern Respiratory Syndrome, so MERS, that's mostly confined to the Arabian Peninsula. Also, there was the SARS outbreak, which was another strain of the coronavirus. And then now, the cause of our current pandemic is the SARS-CoV-2, so the severe acute respiratory syndrome coronavirus 2, which we also refer to as COVID. So again, this is not a new virus, but there's been recent strains that have been more infectious. And this one in particular has been very contagious and been the cause of our recent pandemic. So in terms of the symptoms of COVID-19, the three most common symptoms are fever, cough, and shortness of breath. Now, a few interesting things though is that even though fever is very common, the course of fever in COVID-19 can be waxing and waning. And so there was one study in New York City that showed that of people who were presented at the hospital that tested positive for COVID-19, only about 38% of those people actually presented or showed up to the hospital with actual symptoms of fever. So again, fever is common, but it can come and go. Some other symptoms, and there's a lot of different symptoms that COVID-19 can cause, include body aches or myalgias, changes in or loss of taste or smell. And then there's some symptoms that are less common, but do happen. So particularly GI symptoms or gastrointestinal symptoms like diarrhea, nausea, vomiting, and then headaches, sore throat, etc. Thankfully, about 80 to 90% of infections are considered mild or even asymptomatic. And this in particularly, we see more mild courses or even asymptomatic courses in young children or young adults. Now, the question of how COVID-19 is spread, by far and large, most spread occurs person to person. So this may either be due to direct contact, so hugging, kissing, sharing drinks with someone who has COVID-19, but it can also happen through droplet spread. And I love this picture here on the right because it shows basically the different ranges at which a droplet, which you can imagine as basically a particle of breath or spit that is filled with the virus, has different ranges at which it can spread. And so as you see in this graphic, just kind of breathing or conversation, we can see that the droplets could potentially spread about 1.5 meters, about 4 feet, 4.5 feet. With a cough, it can project about 6 feet or 2 meters. And then a sneeze, which is probably the most forceful way to expel a droplet, can go over 6 meters. Some of you may have heard recently that last week there was an open letter that was written to the WHO that was signed by hundreds of scientists across the world. There's basically asking the WHO to acknowledge that there is aerosol or aerosolization of the virus. But there's increasing evidence, but the WHO hasn't adopted that stance yet. What aerosol is, it's essentially smaller particles that can float and stay suspended in the air and could potentially travel a little bit further. And so that's kind of, the jury's still out in terms of the official stance on whether or not that's spread, but there is increasing evidence. What we do know is that in terms of the spread of the virus, we do know that people can start shedding or releasing the virus even before they start having symptoms. So it can occur as early as 2 days before symptoms. And we also know that the maximum or the peak viral shedding usually occurs at the onset or just before someone starts having symptoms. On average, the incubation period, which is the period between when someone is exposed to the virus to when they start developing symptoms, on average is about 5 to 6 days. And then most people, or specifically about 97% of people who will develop symptoms after exposure will do so within 11.5 days. So again, that's why you hear a lot about people needing to quarantine for about 14 days after being exposed, because generally if someone's going to get COVID after being exposed, by far and large, they will develop symptoms within that 2-week period. This is a fun graphic that some of you guys may have seen this before, but there's a lot of questions about whether or not you can get COVID through touching infected surfaces. And what we do know is that the coronavirus can live on surfaces, and how long it lives on the surface really depends on the actual surface itself. So it lasts much longer on hard surfaces such as stainless steel or glass, tends not to last as long on more porous type of surfaces like paper or cardboard. While in theory it's possible to get COVID by touching a surface that has the virus particle and then touching a mucous membrane or your face, by far and large this is not as common as direct person-to-person spread. So again, still possible, but not as common to get it through surfaces. And then in terms of talking about different types of testing options for COVID-19, the CDC has really good established recommendations for the types of tests that are valid for diagnosing COVID-19. So there's two particular types of tests that they do recommend. So one, and probably the most commonly used type of test, is to look for actual nucleic acid. So it's looking for the RNA particles. And these types of tests have good specificity. And what that means is that if the test is positive, then you can be sure that you have the infection. However, the sensitivity, meaning the ability to catch all positive tests, is fairly limited. So that's where you may hear some people saying that they have false negatives, meaning there may be some people who get tested that actually do have the infection, but their test turns out to be negative. There's also another option for testing, which is an antigen testing. And so what that is actually looking for protein pieces that are attached to the coronavirus. And these are more often used for rapid type of tests. So it's kind of like if you think of a pregnancy test, it's pretty similar in the sense that the response time or the result time is typically pretty fast. Overall, the antigen test, they're still really trying to work out the kinks to it. It's generally less sensitive than the nucleic acid test. So it doesn't tend to pick up as many positive tests as the nucleic acid test. And there's a different, one thing I forgot to mention is with the nucleic acid test, there's a few different ways to get the specimen. So for the most part, they're testing for body fluids or secretions in the respiratory tract, most often in the upper respiratory tract. In the picture below, you can see that there's 3 different areas that nucleic acid tests can be targeted. So a lot of the self-collection tests, so these are the tests where an individual is given a packet and told to collect their own specimen. A lot of times those are swabs that target the anterior nares, so kind of at the tip of the entry of the nose, or in the middle of the nose, the mid-inferior. And then more often the tests that are obtained by healthcare providers are posterior nasopharynx tests. So if you know anyone who's gotten tested that talked about how painful or uncomfortable that swab was because they felt like it was jammed to the back of their brain, essentially, most often that's the posterior nasopharynx test. And then, there's been a lot of questions about blood tests looking for antibodies. What we do know is that after an exposure to infectious organism, the body does create antibodies to offer some immune protection against the pathogen. Currently, though, there's a lot that we don't know about antibodies for COVID-19. In particular, it's not clear whether or not if someone has antibodies, how long that antibody protection lasts for, and if it even offers guaranteed protection against recurrent infection. So clinically, we order a lot of tests to look for diagnosis, and oftentimes we use the nucleic acid test. But in our practice, at least, we are not ordering antibody blood tests just because there's still a lot that we don't know about what those results would actually tell us. But again, lots of researchers around the world doing research on these testing options. And so really week by week, we're learning more and more about the results. And then in terms of treatment for COVID-19, so truly most care is supportive care. And as you guys remember, about 80 to 90% of cases of COVID-19 are mild or asymptomatic. And so most people, thankfully, can actually be treated at home. And really the big things that we emphasize is to treat fever, get rest, and to stay hydrated. Rest allows the immune system someone's own immune system to mount an immune response to be able to fight off the virus. And thankfully, most people are able to recover at home. However, there are some people that have more severe course of infection. And as we know, some people need hospitalization. And again, the mainstay of treatment for people who need hospitalization is really supportive as well. And so what that means is offering respiratory support, so whether it be oxygen through the nose or BiPAP, which is a positive airway pressure. And then again, some people unfortunately do need intubation and to be on the ventilator for respiratory support. There's also a lot of data showing that, again, prone positioning, which is when someone lays on their belly, does help also with airway ventilation and opening up the lungs as well. You guys may have heard about different medications that have been studied, so I won't go in great detail, but dexamethasone and remdesivir have shown to be very possible options. But again, these are mostly medications for people who require hospitalization, who have severe course of illness. And then again, there's a lot of other anecdotal, meaning kind of less researched medications that are being tried, but thus far not great evidence for things like azithromycin, hydroxychloroquine, or famotidine. Now, talking about COVID-19 and Down syndrome in particular, as the pandemic really started to spread all over the world in about February and March, there were quite a few Down syndrome specific organizations really around the world that really took this pandemic to heart and wanted to study how this infection affects people with Down syndrome. And so, and some of you may be familiar with the T21 Research Society, but they basically created a collaboration of physicians, of scientists, and then also various other international Down syndrome groups, and created a COVID-19 and Down syndrome survey. This survey is offered to both healthcare providers who take care of people with Down syndrome, but another survey is offered for caregivers or family members who care for someone with Down syndrome who has been diagnosed with COVID-19. And really what they did was they sent the survey around the world, asked as many people to complete the survey as they could, just to get an idea of how does this infection affect people with Down syndrome, or does it affect people with Down syndrome differently compared to the general population? They're still collecting survey results, but at the end of May, they had published some preliminary results that I just wanted to review, because some of the findings were fairly interesting in terms of how this infection affects people with Down syndrome. So in general, thus far as of May, they had 349 people complete the survey. Most of the respondents who were family members that completed the survey were completing it for individuals who were less than 30 years of age. And then clinicians completed more surveys for adults who are older. And as you see on the right, this pie chart, you see that, I mean, it's really amazing to see an international collaboration, because we've got lots of respondents from Spain, the UK, France, United States, and several other countries. And one of the questions that they wanted to study on this survey was whether or not people with Down syndrome had different symptoms of COVID-19 compared to the general population of people who had COVID-19. So they did, one of the survey questions was looking at symptoms of people who were admitted to the hospital and diagnosed with COVID-19. And as you see, the people with Down syndrome were represented in the red bar, and then the general population in the blue bar. And as you see, the three most common symptoms, so that's fever, cough, and shortness of breath, were similar and the most common for both people with Down syndrome and for the general population. What is interesting is that among people with Down syndrome, we see higher reports of nasal symptoms, so congestion, runny nose, compared to the general population. Now it's interesting and maybe not surprising, because we do know that people with Down syndrome have a unique craniofacial makeup. And so a lot of times people with Down syndrome tend to have more closed sinus spaces or more narrow nose passages. So it may not be unsurprising to see that they tend to have higher rates of nasal type of symptoms. And then one of the other things that the survey wanted to do is to see whether or not people with Down syndrome had different symptoms of COVID based on their age. And so these are the respondents with Down syndrome broken up by their age. And as we see, again, the top 3 symptoms of fever, cough, shortness of breath are the 3 most common symptoms across all age groups. Where we do start seeing differences by age groups is that younger individuals, so ages 0 to 19, tended to have more symptoms of like nasal symptoms as well as sore throat. And then people in the 20 to 39 year age group tended to have more gastrointestinal symptoms, so nausea, vomiting, abdominal symptoms. And then they also wanted, in the survey, they also wanted to see whether or not people with Down syndrome were at higher risk of dying because of COVID-19. And when they look at people who were admitted to the hospital, thankfully that the proportion of deaths among people who were admitted did not seem to be increased if they had a diagnosis of Down syndrome. So overall proportion of death was generally similar to the general population. Where we do see a difference in terms of fatal outcomes, so the risk of death, we do see that people with Down syndrome tend to have higher rates of dying from coronavirus at an earlier age compared to the general population. So again, as you see highlighted in that red box, we start seeing higher rates of death as early as the 40s in people with Down syndrome, whereas in the general population, we tend not to see increased rates of death until their 60s or above. So overall, these were some of the main takeaway messages from this survey result. Again, some things that I'll highlight is that in people with Down syndrome, they may have more nasal symptoms. And then again, one thing that I emphasize to my families is that while people in the general population tend to be at higher risk for severe course and even death when they're 60 or above, what we see is that people with Down syndrome, even starting as young as the 40s, may be at increased risk for dying if they do get the coronavirus. Like I said, this survey is still open. They are still collecting data. So if you know someone who's caring for someone with Down syndrome that is diagnosed with COVID-19, please add to what we know, add to the research by completing this survey. And you can access that on the link that I've put on the slide. Again, from what I know, they are going to be collecting this data for as long as is relevant. And every individual that responds just really helps further our understanding of how this virus affects people with Down syndrome. The other resource that I'm going to share that's specific to COVID-19 and Down syndrome is if you Google Q&A on COVID-19 and Down syndrome, there is a great document. It's about 20, I think it's 20 to 30 pages, so it's long, but it was written by several national Down syndrome organizations and basically has some great questions, commonly asked questions about Down syndrome and COVID-19 that is very helpful for a lot of our families and does answer some very common questions that people may have about this virus. And so in terms of prevention, it's actually, I mean, there's no magic bullet, but there's a lot of easy things that we can do that can make a big difference in terms of preventing infection. So these are not anything new. I'm sure you guys have heard this, but things like staying at home, avoiding close contact with others. Again, generally we say about 6 feet because that's usually about how far a droplet can spread with like a cough. And then going out and whenever you're in public, wearing a face covering, that's hugely important. What we do know is that in some Asian countries in particular, where wearing a face covering is much more common, widely used. In certain Asian countries, they've really been able to control their infection rates. And so it does make a difference. And then washing our hands again and again. And then also cleaning commonly used surfaces. So if you look up disinfectants for COVID-19, there's a great list of cleaners that are used or that can be used to clean, disinfect surfaces from COVID-19. So again, keeping common surfaces clean is really important as well. And then this is just a fun graphic that I wanted to share as well, because it really shows, it highlights the importance and the effectiveness of mask wearing. So again, this is something that many of you guys may have seen, but in the top picture, what we see is that the benefit of wearing a mask is really to prevent someone who has COVID-19. And again, there's lots of people who may have the infection that don't know it, but it really reduces the risk of them transmitting it to someone else. So if you look down below, if both people are wearing the mask, then you greatly reduce the risk of transmission down to 1.5%, whereas the risk can be as high as 70%. If someone who has COVID-19 is not wearing a mask, there's a high risk of transmitting it to someone else. And then just some general tips. You know, I realize that wearing masks is something that I don't think anyone is really accustomed to. And it can be a particular challenge for a lot of the patients that I see, and certainly if anyone has any young kids, it's not easy. So there's just some tips, and many of you guys may have tried this, but just some tips for helping to get kids used to wearing the mask. One thing that I do recommend is for a lot of people with Down syndrome, they relate highly with social stories. And a lot of people with Down syndrome are highly visual learners. And so YouTube has some really great videos with social stories for kids about wearing the mask. Other ideas are to let them choose the mask, decorate it, and then also to practice wearing the mask. I know it sounds funny, but this is something that we talk to our adult patients with Down syndrome who need to use a CPAP about. We talk to them about practice wearing the mask, 5 minutes on, 5 minutes off, 5 minutes on. And wearing a face covering is the same way, you know, so have your child practice wearing it, maybe doing a fun activity while they're watching TV or playing a game, and then reward them for wearing it. If they're able to wear it for 5 minutes, try to get them to wear it for 7 minutes. The more they practice, the more they'll get used to wearing the mask. The other thing is with hand washing, this is hugely important too. So again, making it fun. There's lots of YouTube videos as well about hand washing. And the biggest thing is, again, true of a lot of behaviors, more may be caught than taught. And so making sure that we ourselves are modeling this mask wearing and also hand washing as well is very important. And then a few last things about coronavirus. So what to do if you suspect COVID and you are a family member. This is a time where it's really important that all of us have access to a primary care provider that we can get a hold of, because I tell people the emergency room is the last place you want to go unless you truly have an emergency. So if you suspect that you or a family member has COVID, call your primary care provider, and they can talk you through the options either for testing or advise whether or not you need to actually go in person to seek medical care. But certainly if there's any respiratory distress or emergency, 911 is going to be your resource. The other thing that is unique about families who care for someone with Down syndrome is that it is important to create a plan. And especially it's important to create a care plan for your family member with Down syndrome if you are their primary caregiver and if you get infected with COVID. Unfortunately, we are just seeing lots of community spread, and every day we're getting calls from parents who are testing positive for COVID, or another member of the home is getting tested for COVID. So again, it's important to create a plan of care for your child or individual with Down syndrome, just so there's no interruption in their care as well. And then the last thing is that I refer a lot of my patients and their families to the CDC website, because they've got great guidance on what to do if you're sick. So if you just Google CDC guidelines, what to do if you're sick, There's a lot of good guidance about what to do, and also it addresses how to care for someone when you yourself are sick as well. And then in terms of reliable COVID-19 resources, I probably by far and large, I recommend people check out the CDC website. There's social media is not a great source for reliable information, but here are some resources available. The last resource here is the American Academy of Developmental Medicine and Dentistry, and they are an organization for healthcare providers of people with intellectual and developmental disabilities, and they actually have a coronavirus center that is pretty regularly well updated, so that's a good resource as well. Now I'm going to switch gears. We've talked a lot, or I've talked a lot about disease, about infection and infection prevention. But when we talk about health and wellness, it's about more than just preventing disease. And I love this graphic because it really highlights what the World Health Organization says, in that health is truly a state of complete physical, mental, and social well-being, and not merely the absence of disease. So yes, we're in the middle of a pandemic, and yes, we want to prevent disease and infection, but more than that, we really want to keep people healthy, and keeping people healthy is really more than just preventing infection. And what I love about taking care of people with Down syndrome is that both my patients and then in the community, I see people with Down syndrome who kind of display these aspects of health, of physical health, of social health, and of mental, emotional health. And so again, I'm going to switch gears in this latter part of the talk and really talk about what it means to maintain health and maintain your wellness despite the pandemic, despite all the changes in our routine. How do we maintain our balance of health in the midst of a pandemic? So what I'm going to do in these last sections is just talk about each of these aspects of physical, mental, and social health. And I'm going to talk a little bit about how Down syndrome, or people with Down syndrome, may have unique risk factors that may affect these aspects of health. But then also, I'm going to leave you guys hopefully with a lot of ideas and resources and tips on how to maintain health in this time that we live in. I'm going to dump a lot of information, and a lot of times I tell my medical students when I teach them, if you can remember one or two things, or if you can change or act on one or two things, then I will have done my job. So I encourage you guys to, grab a pen, write down some of these resources, and at the end of tonight, choose one or two things that you can do in order to maintain or optimize the health for you, your family, and your loved ones. So first, just talking about physical health risks for people with Down syndrome. We know that this extra one small chromosome 21, it is small, but there's a lot of implications in terms of what that extra chromosome can do. And so we do know that there's some physical health differences in people with Down syndrome. I will say that this list is not exhaustive, but these are just some of the things that I wanted to highlight. There's a lot of research out in terms of exercise physiology, so how people's bodies respond to exercise, that shows that people with Down syndrome's bodies, their capacity for exercise is just different from someone without. And so we do know that people with Down syndrome have less adrenaline and less heart rate response to exercise. And so they can experience exercise or physical activity in a way that's different from someone who has Down syndrome. The other thing that we know is that there's research showing that people with Down syndrome may have lower resting metabolic rates. So even as you and I are sitting down, looking at our computers, our bodies are expending energy. And what we know is that people with Down syndrome just tend to burn or use less energy at kind of a basal rate. And these things, these changes, these differences in someone's body who has Down syndrome has some health implications. And again, this is not an exhaustive list. This is just some of the things, some of the health conditions that people with Down syndrome can be at risk of. So they can be at risk of having excessive weight, diabetes, hypothyroidism, sleep apnea, arthritis, decreased mobility. And then again, like I said, Throw on top of that a pandemic where everyone's told to stay at home, we're out of our routine of going to school, going to exercise. There's a lot of physical health implications that we can see as a result of all the changes that the pandemic has caused. And so one of the things that I really caution my families and my patients about is just because we're in a pandemic doesn't mean that we stop taking care of our physical health and taking care of our bodies. So some tips, and again, this is not exhaustive, but just some general tips for optimizing physical health and wellness. Is first, I tell families to make physical activity part of the daily routine. There is a study that basically interviewed young adults with Down syndrome and looked for different barriers and facilitators for physical activity. And one of the big things that they saw was that when exercise is part of the daily routine, people were more likely to exercise. And this is true not just for people with Down syndrome, but it's true for me too. So again, make physical activity part of the routine. Make it part of something that you do every day. And that's going to give this the best chance for keeping it going over the long term. The other thing that I recommend is to make sure that you have scheduled meal times and snack times. Unfortunately, when everyone's staying at home, we see a lot, and again, I'm guilty of this, we see a lot of grazing and just kind of continuous eating. And so part of having a daily routine should include having scheduled times for meals as well as for snack times. Also, I can't emphasize enough how important it is to go outside. I realize it's hot, it's humid, it's hard to do, but if you can make physical activity and being outside part of the routine, there's a lot of health benefits from just going outside and getting some sun exposure. And then there's a lot of creative ways to stay active. And this is something, you know, as you guys are an organization and a collaboration of families and caregivers, share with each other ideas about how you're staying active. I have one family that they have a dance break before each meal, and so they turn on YouTube or they turn on some music. And if you think about if each song is about 3 to 4 minutes and you do 2 songs, well, that's 6 minutes, and you do that 3 times a day. Well, there we have it, almost 20 minutes of dancing or activity. So lots of fun ways to make physical activity engaging for people with Down syndrome. And then the other thing that I tell parents, you know, and this is true of us in general, but we really need to model what it's like to have a healthy and active lifestyle. So again, for you all who are caring for someone with Down syndrome, making sure that you yourself are making it a priority to take care of your physical health is really important as well. Now, one of the things that I oftentimes will tell families is that yes, the physical activity guidelines for Americans recommends 150 minutes of exercise a week, which is 30 minutes 5 times a day. But there was a large study that was published a few years ago that involved it was over 10,000 people. That basically their question was, what's the minimum number of minutes of exercise required to start getting health benefits in terms of reducing risk of heart disease, reducing risk of cancer, reducing risk of mortality. And what they found is that as for people who exercise at least 15 minutes a day, they got some health benefit. And so again, I don't want to set the standard low, but I want to make it achievable. And so if you can exercise, start with 15 minutes a day, you'll start getting some health benefits that way. And it makes it easier to increase as you're able to. And again, lots of free YouTube videos that are fun for the family and then also for parents and adults as well. These are just some fun resources that I share a lot with my families. So for some of you guys who are involved with Special Olympics, you may be familiar with some of these. But if you just Google Special Olympics Fit 5, they've got a great resource that includes exercise videos that features athletes or Special Olympics athletes, some of them who have Down syndrome. They also have a really great nutrition guide as well. And the concept of the Fit 5 is basically 3 goals. So the goals are to exercise 5 days a week, eat 5 fruits and vegetables a day, and drink 5 bottles of water a day. So I like simple things, and these are simple, specific goals that really can make a big difference. So that's certainly worth checking out. The other resource from Special Olympics is the School of Strength. which is basically some great exercise videos that features, I'm blanking on her name, but she's a professional boxer or wrestler, one or the other. But they've made some great workout videos, again, that feature Special Olympic athletes. And then a few other online resources for physical fitness is Born to Move is made by Les Miles. Again, free, fun workouts that are broken up by age groups. So there's things for kids in the preschool age up to teenager, adolescents, and then also for adults as well. And then again, lots of YouTube resources. There's listed some of the common ones that I recommend. And then in terms of nutrition, what we eat is hugely important for our physical health. A lot of times I have families who will ask me, what's the best diet? What sorts of things should my kid eat? And really food there's no one size fits all in terms of food. It's very culturally important for, again, a lot of cultures have certain foods that are unique to their culture. And so what I like and oftentimes will recommend is I'll refer people to choosemyplate.gov. And again, I like things that are simple and easy. And what I like about this is that it's straightforward and it shows you appropriate portions of different types of foods that every culture has in their repertoire. So why I like this specifically for people with Down syndrome is that a lot of times people with Down syndrome are very good visual learners. So they really learn a lot through pictures and visuals. And so choosemyplate.gov is a great resource for that. And now moving on to mental and emotional risk factors for people with Down syndrome. I want to start by saying what their strengths are. Studies show that people with Down syndrome have high capacity for empathy. And this is something that you guys may obviously see or experience in your own life, but people with Down syndrome are very empathetic in general and have high capacity for feeling what other people are feeling. Unfortunately, we do see, though, higher rates of certain mental health conditions. So certain mood disorders like anxiety and depression, as well as certain behavioral issues like ADHD, OCD tendencies as well. And so this is a stressful time. I mean, again, if you throw in a pandemic, it's stressful. There's a lot going on. And so this may make people with Down syndrome vulnerable for certain mental health issues. So just some quick tips to help optimize mental health in this time is to first, again, that we as parents or caregivers need to be monitoring or managing our own stress and anxiety, which is a whole talk in and of itself. But again, I tell my parents a lot that in order to care for your child or brother or sister, you really need to care for yourself. And so making sure that you are having time to sleep, to exercise, to have support people to talk to is hugely important. Another thing that I'll emphasize is just the importance of having a regular routine. And again, part of that routine should include physical activity, and I'll also emphasize that sleep needs to be part of that regular routine. So making sure that we're still trying to keep as best as possible a bedtime, a wake up time. The routine can be can offer a lot of stability in a time that is very uncertain. And so this is really a huge thing to help maintain kind of emotional stability and health for someone with Down syndrome. And then if age appropriate, a lot of times our kids or the people around us understand, can kind of sense what's going on. And so if it's age appropriate, you can talk to your child about what they know about the coronavirus. There's lots of resources online. There are YouTube videos as well about how to talk to kids about the coronavirus. And one big thing that is important is throughout these conversations, it is important to emphasize to your loved one, you need to emphasize their safety as well as your own safety. And so that is a huge thing to emphasize as well. And then also making sure that we check in regularly on how our child is doing emotionally is important, not just for people with Down syndrome, but really all children. And so one of the things that I do with my kids is that at the end of the day, we do pillow talk. And there's two questions that I ask them, what was the best part of your day? what was the hardest part of your day? And studies showed that in verbally communicating their emotions and their thoughts, that helps connect or helps integrate some of the experiences that people may be feeling but not knowing how to process. And so again, taking time to check in is really important. And then as well, finding things that are calming or relaxing is important. And then I can't emphasize enough the importance of exercise, not just for physical health, but again, lots of research showing that it reduces level of stress. It helps decrease anxiety as well. One thing that I will say is that there may be times where people in general, and then people, especially people with Down syndrome who may be at more risk for anxiety disorders, there may be some times where you do need to seek professional medical help. And so in particular, some things to monitor is that if you notice that there's a loss of skills, like social skills or cognitive skills, or if your loved one starts to withdraw and is less engaged, or if you hear negative self-talk or any other distressing signs, please call your healthcare provider. And because some people will need professional medical help to address this as well. And then the last thing, talking about social health risks, again, the strengths to start off of people with Down syndrome, we already talked about their capacity for empathy, but people with Down syndrome also have high capacity for social understanding and functioning. And so generally people with Down syndrome have a high social skills that can really be a strength for them. And so unfortunately, in times of physical distancing, there can be, this picture can kind of display how someone with Down syndrome may actually feel during this period of physical distancing. And so we certainly see that with social isolation or with loss of the routine, people may be at risk for worsening depression, anxiety, or even just social regression where they withdraw and lose some of their prior social skills. And so again, you know, social health is really huge. And so as much as possible, trying to stay socially connected and being intentional about scheduling those opportunities for your loved one is really important. And so here are some options, you know, just ideas, and I'm sure many of you guys are doing this as well. And I know the DSAH is, you know, really trying to use as much virtual platform for activities as well. The other thing is that, you know, I tell families that this may be a unique opportunity for families to start spending more time together. So even if the day program or the school is closed or, you know, prior activities are no longer available, making time for families to have fun time together is really important. Also, we have some adults who worked before the pandemic who now currently are not working. And so I encourage families a lot of times to maybe teach new jobs at home to replace that prior sense of job and responsibility that someone had before the pandemic. And then lots of free online classes that are available. And then the last thing is that, you know, in this time where maybe we feel a lot of social isolation, you know, we can really sometimes introspect and sometimes to our detriment. And so one other idea is to find unique ways to serve others. And so that may be encouraging your loved one to maybe write a letter or call someone who maybe lives alone or who's ill at this time. Overall, though, again, you know, we live in a very uncertain time. And again, week by week, we're learning new things about the coronavirus. But what I tell families often is that you can stay healthy, you can stay well during this time of uncertainty and during this time of a pandemic. But it does take some intention, it does take some work, and biggest thing is that, you know, it takes some accountability as well. So it's great to see organizations like the Down Syndrome Association still having programming, and I would encourage you guys to continue to reach out to one another, share ideas about how you're maintaining your health in this time, because we really do need each other to keep us accountable for this. So that's all I had for tonight. I know this is a lot of information in not a whole lot of time, but I'm happy we're getting close to the end of the time. But if anyone, and I see that there's 2 people on now, have any questions, I'm happy to answer them as best as I can at this time.